You're recognized for 5 minutes.
Secretary Becerra, I want to thank you for your service to our country. I want to thank you for your valiant attempt to answer actual questions in the hearing today. And I also want to thank you for trying your best to save lives during the global pandemic with all the information you and all the medical professionals had at the time, for your attempt to save young lives and old lives and everybody in between. I also want to thank you for visiting my district, where you attended a roundtable with my constituents to listen to them talk about the importance of federal funding for federally qualified health centers, which provide critical health care to the most vulnerable among us. And I want to thank you for attending a roundtable on the devastating impact of the Dobbs decision on reproductive health care for women, not only on the freedom of women to decide whether, when, and with whom to have children, but also the negative effect on women seeking care for miscarriages, and hearing from physicians in my district about how they are handicapped in their ability to provide the best care to their patients because of confusing and restrictive legislation passed by extreme state legislators in the absence of federal legislation that is so dearly needed to protect women's health care. As you stated to my colleague, Ms. Bonabici, pregnant women are more than 3 times more likely to die during pregnancy in states that enact abortion restrictions. This is an appalling outcome, and this Congress should be taking action to protect the health of women and girls in this country, not standing by while women and girls' lives are being put at risk by extreme politicians. Secretary Becerra, even before the Dobbs decision, the Trump administration took many harmful steps to undermine access to reproductive care by allowing employers to evade the Affordable Care Act's requirement to cover contraception without imposing cost sharing on individuals. Earlier this year, HHS, DOL, and the Treasury proposed rules to roll back these harmful actions while creating a new pathway for women to receive contraception when their employers seek religious exemptions. Can you talk about how the proposed rules will expand access to contraception, and also tell us what HHS can do to ensure that insurers comply with federal law and cover contraceptives?
Congresswoman, there is no doubt that without contraception services, we would have far more difficult pregnancies. We would have many more cases of families that are in dire need. And what we find is that contraceptive services, which are usually undertaken by a woman after consultation with her medical provider, an expert, and in consultation with those who are trusted advisors, help us make sure that when we see a family ready to grow, it's because they've really been working to plan that. And so we're going to do everything we can to make sure that contraceptive services are available, that the information and counseling that a woman should have so she can make the right decision is provided to her. And certainly we'll do everything we can to protect the rights of that woman to receive those services. And if anyone attempts to prevent that and discriminates against that woman, we will take whatever action we can to enforce her rights to be protected against discrimination.
Thank you. I'm going to change topics here. You said earlier to Mr. Desailly that mental health should be put on par with physical health. You were talking about the mental health crisis in our schools. And I just want to mention that I am trying to do that with my mental health wellness in schools bill, which would put mental health services and information on par with physical health and healthcare and services. So the most recent CDC report did outline a severe decline in students' mental health after the pandemic, and particularly mental health issues faced by teenage girls. In the president's budget, HHS requested $90 million for its school behavioral health program, What Works in Schools. Can you walk us through this program and talk about how it will help combat youth mental health problems?
Congresswoman, as you're aware, the mental health challenges facing our young people are growing dramatically. The closer we can get to providing that care where they are on a daily basis would help them. And so we're going to try to work with schools as much as we can to make those mental health services available to all those young people.
Thank you. My time is about to expire, so I will yield back. Thank you so much for your service.
Thank you.
Thank you, Ms.